Today, I really want to take some time to talk through the dietary guidelines for Americans because they're being discussed everywhere right now. So you might have seen it. They're discussed by the general public and especially within nutrition, culinary medicine, and health education spaces. In one of the graduate programs where I teach, we spend time diving deeply into the dietary guidelines. We compare the US with the Canadian guidelines, and we look closely at how their messaging aligns. What is it telling its people as far as what to eat? Also talk about what doesn't, and what of these align with evidence-based nutrition research. So let's start with a little context. The dietary guidelines for adults in the United States began in 1980, and they're updated every 5 years. Over a 2-year period leading up to the recommendations, top nutrition scientists review available research and develop recommendations. And this is a group of about 20 nutrition scientists, and they meet twice a week for 2 years. So really looking at all the evidence-based research that has come about. And they hand their recommendations to the government, to HHS, and from there, this is where political groups and political realities can influence what ultimately gets published. So the very first guidelines emerged after decades of rising cardiovascular risk. So that means increased risk of heart attacks were being seen in our society. And researchers were starting to also understand that our genes were not our destiny. So essentially, they were the first sets of nutrition studies that showed us that there were modifiable risk factors. And much of that early insight came from the Framingham Heart Study, which has had many different evolutions over time. So the original message of those recommendations was simple: eat less red meat. But then that became translated to eat less saturated fat. That was actually what was in the dietary recommendations. But most people don't know what saturated fat is. So how that got translated, it became eat less fat. So welcome to the fat-free phase of our society that started in the 1980s. So this is where the low-fat and the fat-free era began. And there was a surge in highly processed foods. Partly to make them no fat and to add flavor, we added a lot of sugar. So over the years, the visual messaging has shifted from a food pyramid to the My Plate, and most recently with these guidelines with the upside down pyramid. So what's new in these and what's missing? So the new guidelines are 9 pages long compared to more than 90 pages in the previous version. And in some ways, that's fantastic. But I found myself wanting there to be links for people who wanted deeper information to understand the recommendations and how were they decided upon. And yes, there is a separate scientific report that's over 400 pages long, and most people won't have access to it either because they don't know where to find it, or it's outside of their time constraints or interest level or understanding. So as I read the guidelines, I kept finding myself thinking, yes, and meaning I wanted more information. I didn't want it to end there. And specifically, I wanted more practical guidance, something that truly empowers people to know how to shop, cook, and eat, because we all need to do that at least 3 times a day. So why does more practical evidence-based nutrition guidance matter? To give you a context, right now, more than 80% of chronic diseases in the United States are related to lifestyle, primarily food and physical inactivity. So the hopeful part is this, that genes are not our destiny. There are a lot of things that we can do to improve our health outcomes. So that's where dietary guidance matters. There are elements of the guidelines that I do appreciate, and they give me hope. So I appreciate the emphasis on eating more real food, more whole, nutrient-dense foods, and on reducing highly processed foods, often referred to as ultra-processed foods. I also value the focus on scratch cooking or homemade meals, and the encouragement of involving children in the preparation at different ages. It's a foundational aspect for long-term health. I also appreciate the continued emphasis on water, both still and sparkling, as the primary source of hydration. I also appreciate the recognition of olive oil as a healthy fat. It is the least processed of fats that we use for cooking. It comes from the plant kingdom, and it has a strong evidence base behind it. Now, where I have concerns. So my biggest concern is the heavy emphasis on increasing animal protein and animal fats, which also increases saturated fat intake. So even when these foods are less processed, we have decades of evidence linking higher saturated fat intake with increased cardiovascular risk. So this includes heart attacks and strokes. The protein recommendations themselves have also shifted significantly. So we went from recommendation of 0.8 grams per kilogram of body weight to 1.2 to 1.6 grams per kilogram. That's up to double the previous recommendations. And the issue is that most Americans already eat more protein than they need. If someone follows the guidelines exactly as written, so if they're prioritizing animal protein and full-fat dairy at most meals while also staying within the calorie limits, they're almost inevitably creating a fiber gap. So fiber comes primarily from plants. So vegetables, fruits, legumes, which is anything that grows in a pod, whole grains, nuts, and seeds. So when animal foods take up most of our plate and the calories, there's simply less room left for fiber-rich foods. There's only so much that we can pile on our plate. We already know that most Americans fall far short on the fiber recommendations. So we're already getting too much protein, too little fiber, and now we're emphasizing more protein and not emphasizing fiber. And fiber is not just about digestion. It plays a critical role in cardiovascular, which is our heart health, blood sugar regulation, which has to do with diabetes, cholesterol metabolism, the gut microbiome, which is a healthy bacteria in our gut, and we want it to be diverse, and fiber helps with that. Also has a role in inflammation, immune function, and satiety, which is feeling full after meals. So this is where the internal contradiction becomes clear. You can't meaningfully close the fiber gap while at the same time de-emphasizing the very foods that provide fiber. So the guidelines do mention fiber. I want to say that, but without giving it the structural, visual, or practical priority needed to help people actually meet the fiber needs in our daily life. So for me, as a culinary medicine physician, from my perspective, this matters a lot because people could technically follow the guidelines and still move further away from cardiometabolic health if fiber-rich foods are crowded out on our plate. There's also very little emphasis on plant-based proteins, even though they're mentioned. And there's no discussion on how animal proteins are raised. And the reason that's important is if you have something that's 100% grass-fed or grass-finished versus grain-fed, as an example, it significantly affects the fat composition in the meat, and that affects health outcomes. It's also important to say this clearly. Eating more protein alone does not build our muscles. We can't sit there eating a steak and watching a football game and expect that we're going to gain muscle. Excess protein gets converted to fat when it's not paired with resistance training. So again, to summarize, muscle requires stimulus, not just intake of it. So we can't just eat it and build muscle. Now, moving on to when we talk about in the guidelines, dairy, gut health, and fiber. Dairy is still recommended at 3 servings per day. That hasn't changed, but there's now much more emphasis on full-fat dairy. And there's also no clear explanation on why the shift occurred. There's no acknowledgement that many people don't tolerate dairy well at all. And fermented dairy like yogurt, kefir, and fresh cheeses are barely mentioned, even though these forms are often more bioavailable and better tolerated. I do appreciate the increased discussion of gut health and the microbiome. There's a small separate section where that's talked about, which is a step forward. But again, gut health cannot be meaningfully supported without adequate fiber intake. And that connection isn't clearly made at all. Now, talking about fruits, vegetables, and whole grains, I appreciate the encouragement to eat fruits and vegetables throughout the day with more variety. I also love that frozen, canned, and dried options are included. This feels much more inclusive and realistic. Juices are discouraged, but without explanation. So to explain it here, juices have no fiber, which causes sugar spikes. So even if they are 100% juice, they still have health consequences compared to eating a whole fruit like an apple. Now, we talk about serving numbers, how many servings to get of a specific food, but there's no clarity on what a serving size or portion size is, or it actually looks like. And it's listed again in a separate supplemental piece, but how many people are actually going to see that because it's not easily accessible? Whole grains are described as important, yet they're visually really de-emphasized in this upside down pyramid. And there's no explanation of what qualifies as a whole grain versus a refined grain. Again, missing an opportunity to support fiber intake and protein intake from a plant-based source. This is a reminder that whole grains have protein in it, something that we like to separate that into different categories. But if we're eating whole grains, we're also getting, again, both that fiber and the protein. When we talk about sugar, alcohol, and sodium, I strongly support the recommendations to reduce sugar-sweetened beverages and non-nutritive sweeteners. So that would be the diet or zero versions. However, the guidelines around added sugar is confusing. There's no clear daily limit as there used to be. There's only a suggestion to have less than 10 grams of added sugar per meal. And now alcohol guidance is really vague. It simply says to drink less, not less than what, not any certain numbers. Previous guidelines were clear, and newer research, including updated Canadian guidance, suggests minimizing or avoiding alcohol altogether. Alcohol used to be framed as a heart-healthy conversation because that's what the studies had shown. Now, there's new studies that show it's a brain and a cancer conversation. Canada has moved towards recommending zero or near zero alcohol because the evidence has shifted. From brain health to cancer risk, there's no clear threshold where alcohol becomes protective. Even smaller amounts affect cognition, sleep, mood, and long-term brain health, and alcohol is now clearly linked to increased cancer risk at low levels. So when you look at the full picture, not just the heart, but the brain, the mental health, the injury risk, and population impact, the conclusion is simple. Less is better and zero is safest. And again, this comes from the latest evidence-based information. Sodium and electrolytes are mentioned as necessary, but without context. This could easily be misinterpreted as a need for supplements, without noting that these nutrients are readily available in the whole foods that we are promoting and having people consume. Looking at planetary health, there's really a missing lens here. One more piece that's notably absent from the new dietary guidelines is planetary health. Sustainability is not mentioned at all. That's striking, especially given what we know and again, what evidence continues to show. Food systems affect climate, soil health, water use, biodiversity, labor, and long-term food security. These are not separate from human health. So when dietary guidance ignores planetary health, it misses a chance to align personal well-being with the systems that make food possible. It also overlooks growing evidence that dietary patterns higher in plant foods and lower in resource-intensive animal foods support both human and environmental health. This isn't about eliminating animal foods. It's about acknowledging trade-offs and offering guidance that reflect the world we're actually living in right now. So food is medicine, but food is also agriculture and land and water and labor. When planetary health is left out of the conversation, we're only telling half of the story. So my bottom line, I keep coming back to one central question. Do these recommendations truly empower people to use food as medicine in their daily lives? Eat real food, which is the messaging that is coming with these new guidelines, only works if it's grounded in real life. And many of these recommendations feel like a return to the 1950s food system that doesn't reflect what most people have around them or how people live today. So most people don't grow their own food. They shop at grocery stores. They have limited time, budgets, varying cooking skills, and deeply rooted cultural food traditions. So when I step back, the overall message seems to be eat more animal protein and full-fat dairy at every meal, while also keeping saturated fat at 10% of calories. That combination makes it very easy to widen the fiber gap, and it completely sidesteps planetary health at a moment when both matter deeply. And that's my biggest concern, not just for individuals trying to do it right, meaning following the guidelines as they're being told, but how do these guidelines get interpreted by food companies, translated into school meals, and applied across federal nutrition programs? People need clarity, context, and skills, not just simplified messages or ideological swings. My hope is that this episode helps you evaluate the guidelines a little bit more thoughtfully, taking what's useful, questioning what's missing, and applying it in ways that are truly supportive to your health. Until next time, salud and bon appetit. Please note that the content or opinions in this episode are for informational purposes only and are not a substitute for professional medical advice. If you are uncertain if an ingredient mentioned here is suitable for your diet due to allergies or other reasons, please discuss with your doctor or other qualified healthcare provider.